The National Cancer Institute recently estimated that missed screenings during the pandemic will result in well over 10,000 additional deaths from breast and colorectal cancers over the next decade. And that's just for two cancer types. Dr. Brent Wallis from People's Health joins us to discuss the importance of people still getting those screenings and the new technology being used to conduct them. Good morning, doctor. We appreciate your time.
Thanks for having me.
So again, why is it so important, or before we even get there, talk about the year and the number of screenings that you all have seen fall off since the start of the pandemic.
Yeah, screenings are so critical for us to identify disease earlier so that we can treat it more effectively. And what we're really seeing this year with the pandemic is a huge drop off of diagnoses and therefore treatment for those patients. In particular, the top 6 cancer diagnoses since the pandemic, we've actually seen a 50% drop in identification of those. And so we know the cancers didn't go away, but we're just not finding them.
So I know during the summer we kind of had a lull in COVID cases, so doctors' offices did start picking up with appointments and screenings and what have you. Did you all see that ever pick up, or has it just it was a drop off and it never has come back up?
Yeah, we saw that dramatic drop when all the elective procedures were canceled. And then we saw a slight return for some of our patients, but really it hasn't gotten back to the pre-pandemic levels. And that's what's so concerning, because we know that disease is still out there. Again, we're just not identifying it yet.
And when it comes to some of these cancers, really most cancers, but definitely some of the top ones, early detection is key. So people not going to the doctor's office, what does that mean for their treatment? What does that mean for what we'll see next year?
Yeah, it's much easier to treat cancers and all types of disease if we identify them early before there's complications. And so this delay in diagnosis can actually result in, a longer treatment to cure, or even in bad situations, it could result in a really bad outcome, even death. So that's why it's so critical to make sure that you're seeing your doctor.
We have about 45 seconds left to talk here. Talk about the COVID protocol in place at these doctors' offices, in case there's anybody at home watching right now who thinks, oh, I should go to my doctor, but what about COVID?
Yeah, so, a lot of people are still worried to come in, but let me tell you, this is probably one of the safest times to go see your doctor. We all have extensive protocols in place. We have all the PPE necessary to make sure that we protect you. And it's so vital that people come in so that we can, again, identify these diseases and get you set on your treatment. So don't be scared.
Anything else you want to get across to people today? Again, you just mentioned how safe doctors' office is now, and you mentioned the importance of getting these screenings as early as possible. But anything else you wanted to just drive home to people if they're sitting at home, like I mentioned, and kind of on the fence about going back to their appointments?
Yeah, I think even if you do a televideo visit with your doctor, ask them about screenings that can be performed in your home. In particular, colon cancer can actually be screened in the home, and then you can actually consult with your doctor via video to see what the next steps are. So it's something to talk to them about so that you're making sure you're taking care of yourself.
So just be in contact with your doctor's office, be it telemedicine or in person, but the key is to keep those lines of communications open and those screenings and treatments ongoing as well. Thank you so much, Dr. Wallis. We appreciate your time.
Thank you.